Roxanne Williams, any of the products will help with pinched nerves. Pinched nerves, let's clarify so that everybody knows what we're talking about. Pinched nerves is when a nerve coming out, usually of the back, where the disc in the back, where you have the vertebral bodies of the back, they're stacked on top of each other, and there should be a space between them, and that space has a cushion so that the two bones never in contact with each other. Whereas we age, those cushions lose fluid and they start to shrink. You also get arthritis changes in your spine, so they start to get inflamed, and you can actually get bone on bone. The bones can start to deteriorate even further. That's called spondylitis, inflammation of, and then the spinal vertebra can even shift. That's called spondylolisthesis. Spondylolisthesis, and all of these are very, very. What happens when anything in that area moves is moving toward or away from a bundle of nerves, and nerves are very sensitive. If you just barely touch them, it sends an electrical shock sort of feeling throughout whatever the distribution of that nerve is. So, how do you treat a pinched nerve? One, you treat the inflammation. Two, you unpinch it. Oftentimes, it's a surgical procedure to do that. People have operations on the neck and the back to unpinch nerves. But there are some newer therapies now utilizing lasers. They make a tiny incision that's really about as big as fat as a large needle. That apparatus has cameras in it. It also has laser capabilities. So you go in, you spot the bulging disc or the prominent bony spur or whatever, and you just zap it with the laser, and you finish. You put a band-aid on a person, they get up and walk away. Amazing therapy for chronic back pain, pinched nerves, if you will, ruptured disc, etc. That doesn't require long-term recovery, because the old school option is to cut through the skin, all the back muscles to get down to the spine to relieve that pressure. And oftentimes the surgery does more damage than there is damage when you are trying to recuperate from it. So it's very, challenging to get back surgery or neck surgery nowadays. But there are newer surgical techniques, again, utilizing a lot of the technology, including lasers, that make these processes much easier to tolerate and much easier to recuperate from. So great question, Roxanne. We appreciate you.